Okay, thank you so much. And my apologies once more for the delay in starting up the session. However, just to welcome everyone for being taking your time to come and listen to our session, which is on strengthening systems of TB survivors and civil society, which is mainly going to be looking at community system strengthening and the engagement of TB affected communities and civil society. Our main area is to discuss what community system strengthening is, and then also give practical examples of community system strengthening. We have a very good team of speakers. We will have RD Mate, who will be talking later on. We'll be unpacking community system strengthening and how it to make it work for communities. And then after RD Mate, we will have Mara. Mara is the executive director of an organization which is called Achieve in the Philippines. And I forgot to also introduce RD Mate as the executive director of APCASO and based in Thailand. And Mara, coming back to Mara, she'll be giving us an example from the field, especially around community rights and gender assessments and community-led monitoring as key advocacy tools for communities. Within the same experience sharing, we will also hear from two people. This is Eden. Eden is a TB survivor, also from the Philippines. Eden Mariano will be talking about coordinating communities to amplify the voices of TB affected communities. And Eden will be sharing this same topic with Roderick Mugishagwe, who is also from Tanzania and coordinating the Tanzania TB community network, and also within IANASO, the TB officer. Lastly, but not the least, we will have James Mala, James Mala works with Stop TB Partnership and is part of the CRG team within the Stop TB Partnership in Geneva. And he will be talking about how strengthening community systems support the global TB response and opportunities. I just wanted to say briefly that we are all aware how community response is very critical when it comes to TB response as a part of health systems. In Africa, we have an adage that says, he who wears the shoe knows where it pinches most. Someone cannot come and talk about your issues when you are the one who knows everything that you are going through, the challenges you face as you go to access health services, or if you are a minor and you are not given your rights of compensation or your right to access health services when you need it, or as a woman who, just because of the culture and social aspects, you're not able to freely provide your sample in terms of your sputum sample, and this affects the way you are able to access health services. These are just examples. Even when it comes to children, what are those key challenges as communities, in terms of stigma, in terms of access to justice when you have not been given your compensation. So today, this group, this panel of speakers will define to us community system strengthening, will also give us examples of how this is happening from various countries and contexts, how coordination is happening, but also James will later on give us a brief on how all this work that civil society and communities are doing is strengthening the TB UN high-level meeting declaration that we committed to, and also how we can take our leaders more to task and be more accountable for what they had committed to. So without wasting much time, let me bring on RD Mate. RD, who is going to take us through her slides. I think she has a pack of slides. James, I don't know James, if you're the one who's putting on the slides for us. She is going to,
it's fine.
Okay, thank you so much. If you can put on your slides, thank you. RD.
Thanks so much, Olive. And hi, everyone. Good afternoon from Bangkok. It's currently 3:30 p.m. here. So I'll just put on my slide. Yeah, everybody, I guess, sees my screen right now. If you don't, please let me know. Anyway, what I'll be doing is that I'll hope that we would be revisiting the fundamental concepts of CSS as a kickoff to the discussions would happen later with the other panelists that are going to give more concrete country experiences and examples. So, I mean, for many of us, community system strengthening wouldn't be new. We know why it's important, but I guess it's also still good to walk through to try to come with clearer common understanding, and also what does it mean for TB communities and for TB mobilization and for TB advocacy. Okay. So the concept of community involvement in improving health outcomes is not new. It's not a new one. The concept has roots in the action that communities have always taken to protect and support their own members. Like if you ask, like, who are the people who have the greatest vested interest in issues that concern them, it is those same people who are affected by those issues. Particularly for TB, where the communities affected are often vulnerable and marginalized, I would consider community system strengthening actually as a game changer. We all know that TB has existed for a long time. We all know, of course, it is not enough, but the responses have been mainly biomedical, and we all know also the slow progress that we've had in terms of achieving some vision and goals that we have related to TB, and that is because it has only taken very recently where support for community mobilization for community system strengthening has been happening in TB. And for me and for APCASO, the organization where I work with, we really stand by the belief that if we really want to change the game in TB, community system strengthening is the answer. So just to contextualize why CSS, I put this first, the why do we need CSS before we define it and unpack it, and before we think of how to operationalize CSS, just to put primarily the context of the importance of CSS and why we are even having this session, why we need to push for it in country, regional, and global programming. So if you see this diagram at the bottom of it, what it basically says at the end of the day, what we are looking for as a global community, as communities in our respective locations, are good health outcomes. Also, other positive outcomes in terms of, for example, greater involvement of communities in matters of life that affect them. It might not be related to health, it might be related to other social health issues. What this diagram further says is that to achieve this, there's a very strong contribution that comes from having strong systems of health. At the same time, you cannot have strong systems of health if you do not have, amongst other things, strong health systems. But strong health systems is not enough. We definitely need strong community health systems. And we do need strong community systems aside from strong health systems, because we know that health outcomes have social determinants. We need more than biomedical health responses. It's actually social communities, it's actually social systems which would have the power to affect changes in social systems. So this is the basis of CSS. And why CSS? The goal of community system strengthening, and this is a definition from the Global Fund CSS framework, is to achieve improved health outcomes. So the long vision is improve health outcomes by developing the role of key affected populations and communities and of community-based organizations in all aspects of health interventions, from the design to delivery to making decisions over funding to monitoring, etc., etc. Okay, so I hope that at least within this group, there's no argument about the importance of CSS in achieving effective health interventions. Okay. When we go to the what of CSS, we could look at this diagram. At the top, you would see that community actors could be defined broadly. This could be individuals, this could be organizations, this could be networks that have a common agenda, have a common interest, who develop and manage systems. Community systems here are community-led structures and mechanisms which are used by communities, through which community members and community-based organizations interact, coordinate, and deliver responses to the challenges and needs affecting their communities. So at the bottom, you see services interventions for communities. At the top are the community actors. How they deliver program are through systems. So many community systems are small scale or informal, other are more extensive. They could be networked between several organizations and involve several subsystems. If we look at this diagram and then go to the definition, just to make the textual definition of CSS relate to the diagram. And again, this is from the framework that have been developed by the Global Fund, which I find not so bad. So CSS is the approach that promotes the development of informed, capable, and coordinated communities. So working at this top level, so strengthening this top level and organizations so that they're able to work within a system that delivers and contributes to effective services and interventions for communities. So CSS is not only a way to improve access and utilization to formal health services. Of course, that is one of the reasons why we need strong CSS or strengthened community systems. But in and of itself, it's also a worthy end goal. It is a way to increase the meaningful engagement of communities as actors as well as recipients in healthcare. Okay, so just one more slide, or my second to the last slide. If we look at, like, so, okay, we know that CSS is important. We have a common agreement of what CSS is, but how do we make CSS happen? From the concept, how does it get operationalized? If we try to answer this question, I think it would be go to a more fundamental question of like remembering that diagram of the community actors, the community system, and the interventions. Basically, if we want to answer how to do CSS, we also ask the question of which in those diagrams do we have to strengthen. Basically, what are essential for creating functional, effective, and community systems? This would give you the answer. What would enable community organizations, networks, and actors to fulfill their role of contributing to health outcomes? Okay, so there have been a number of discussions on this at various levels, and in that framework paper put together by the Global Fund, they have tried to organize the answers to this in 6 components, and I think this would find resonance in the work that we've been doing and the work that we want to see, particularly in TB. So the fundamental or the basic essential components of CSS, we could look at it in terms of those that are clustered around making sure that there's enabling environments and advocacy. And of course, this would include support for community engagement and advocacy for improving policy and legal environments and affecting the social determinants of health. Advocacy, that is very close and dear to the work that most of us do as communities and civil society, and it is part of community system strengthening. Community system strengthening also entails supporting community linkages, community organizing, community mobilization, partnerships, and coordination. Because of course, like if there's no networks, if there's no formations, if groups are not mobilized at whatever levels they operate, nothing would happen. This is the basic founding block of community system strengthening, is to make sure that there are actually groups, community networks, and groups that exist to be able to do work together and plan work together, either in advocacy or in service delivery or in peer support and other aspects of health responses in TB. It also includes ensuring resources and capacity building, resources both human as well as technical and financial. Not only that they're there, but also that they are of a sufficient and high quality, sufficient funding, material resources, and infrastructure. Because we know that our work as communities and civil society cannot be just done out of passion. We also need tools and resources to support the work that we do. Part of the components also, if you would see, the fourth one is community activities and service delivery, organizational and leadership strengthening. A strong organization needs strong leadership, also needs strong organizational systems and structures in place. And then, of course, the important role of community-led monitoring, so that communities are able to provide feedback on the quality of the services that they receive or of the policies that are developed or not developed in their countries that affect their lives. I'm going through this a bit fast because these are, again, I mean, the organizers would provide to you the slide, but this is really just an overview and an attempt to unpack the different components and elements of community system strengthening that would frame the discussions of the next panelists. So just going to my last slide, to me, the most important part is, like, we, as communities and civil society, we know that it is important. Recently, thankfully, we are finding resonance with technical partners and donors saying that CSS is also important. But I think we need to translate this outward commitment in terms of actual, put your money where your mouth is. If groups, if different stakeholders indeed see community system strengthening as essential to effective TB responses, like, these are components, these are things, these are approaches that are not just nice to do because, like, who would refuse to involve communities, but are actually essential. Like the principle is, even if you have 1,000, a dozen TB programs, if you don't have CSS to make sure that the barriers to accessing those programs and interventions are addressed, then your programs would fail. So if we are hearing support for CSS from different partners, then we also need to see concrete funding and sufficient funding to go into CSS. This means sufficient funding for core funds, for community mobilization, for community organizations, again, like, there's a lot of value in terms of voluntarism, like communities gathering together, working together. But the other part of that is we also need the support, including financial support, to be able to do all the things that we need to do to improve TB health responses. Another part of that, aside from funding, is that the commitment to CSS from other stakeholders need to be reflected in the programs, in TB programs. These have to be embedded as core components of TB programs going forward as well at the country level. Not just, something special or project or pilots, but as part and parcel of the norm. If there's a package of TB programming in a country, CSS should be there. So with that, I finish my part of the panel. Over to Olive, and thanks, everyone.
Thank you so much, RD, for taking us through defining community system strengthening, but also looking at some of the interventions that define, what community system strengthening interventions look like. Really appreciated. So in terms of the practical examples, let us move on to Mara. Mara is the Executive Director for Achieve. But before Mara comes in, I'll quickly want to ask all participants if you can introduce yourself in the chat box, but also if you have any questions, there's a Q&A box whereby we can interact with the various panelists. And I can see a question. So the panelists, if we can also try to respond to those questions. Mara, over to you before I take more of your time. And please keep it to around 8 minutes. I'm sorry for eating your time.
No problem. Thank you, Olive, and thank you, RD, for setting the frame of the discussion that we have this afternoon. So I think RD pretty much covered everything that has to do with CSS that we need to understand. But before we can even strengthen community systems, there's a need to actually understand the realities faced by the community, the dynamics that they have with each other, and with the stakeholders and service providers that they interact with, because that informs us in the kind of approaches that are appropriate, given that the community of people affected by TB are also very diverse. There are existing tools that have been used in several countries already to find ways in terms of understanding and generating data that would help us in strengthening community systems. One is the CRG tools that we have, communities, rights, and gender tools that have been used as a means to assess the socio-cultural, economic, and legal environment that impact people affected by TB. And in several countries where CRG has been rolled out, it has actually provided an entry point for governments through the NTP to be able to enhance the way they engage with communities, because now they have a better understanding of how it is to involve communities and the importance of involving communities in designing, implementing programs, as well as monitoring and assessing these programs later on. The other advantage of having these types of assessments as well is that it provides an avenue for the national TB response, the program drivers, the CSOs, to determine if we're missing out on certain communities that we do not traditionally reach in conducting our TB, in implementing our TB programs. Because a specific tool that we have in the CRG package is that it allows us to also find communities that are not, that may be missing. That's why a huge amount of resources that we have from donor funding at the moment is devoted to finding missing people, because obviously we may be missing out on certain communities that have been systematically marginalized over the years and have not been able to access services and programs that we have. And so they continue to remain vulnerable to TB infection and TB disease. And tools like this help us to determine these landscapes that we need to explore in order to make sure that we are providing, and governments are providing, the right types of services, the appropriate types of services and interventions, as well as providing the kind of platforms that would allow communities to engage in decision making, in implementing programs, in monitoring these programs, and eventually assessing the effectiveness of the programs that we have. In relation to monitoring, there are also recently a surge of various ways of various forms of community-led monitoring and community-based monitoring. Some of them through the technical assistance from Stop TB Partnership have been rolling out a digital-based community monitoring platform called the One Impact that allows members of the community to directly give feedback on their experiences when they encounter service providers, or even report experiences of stigma and discrimination within their communities, within the institutions that they interact with, at work, at school, or in the healthcare setting. And this is very important because it allows us to also ensure that when we develop community systems with the communities involved, that we do not miss out on the uh, non-health programs and service providers that the communities also need. Remember that TB is not just a health issue. That communities who are affected by TB also encounter a host of different issues and concerns in their everyday lives, with or without experiencing TB at the moment, but being a part of communities that are affected by TB, they also encounter all these things, and we need to make sure that interventions are holistic, and we can do that by ensuring that when we do build community systems, that the community is also aware of this host of needs and concerns from the community that need to be addressed in order to eventually achieve the outcome of CSS, which is improved health outcomes. In the Philippines, we are actually currently in the process. I was just in a meeting before this of developing an app, the Care TB app, which allows the users to locate service providers around them, to track their treatment, um, as well as to provide feedback in their encounter with facilities and service providers. As access issues, availability issues, quality of services, and report experiences of stigma and discrimination. So this would allow us then to utilize data coming in from these apps for advocacy purposes and program development. But I do have to, and this is my last point. I hope I'm not going overboard. I do have to mention as well, because community systems are strongest when it is initiated by communities themselves. And so when we develop these tools, we need to make sure that they're community friendly. For instance, if our tools that generate, say, assessment data, but we need a lawyer for us to be able to implement such a tool, because otherwise it becomes too technical, then we might be unintentionally marginalizing communities more. Remember that we have to make sure that the communities do not remain merely sources of information. They have to be able to implement assessments on their own. They have to be able to do monitoring on their own. Their capacities need to be built in order to do this on their own. And their tools that we develop need to be friendly so they can use them on their own. I think that's quite important when we say when we commit to providing spaces for community system strengthening. That's the only way for us to really ensure that the diversity of the communities that we work with are all being able to equally, or at least at the most possible way, at the best possible way, they are engaged, achieve encounters this in our daily work, because we work with the most marginalized of those affected by TB. Most of them come from the poorest communities. They don't have access to technology. And so if our tools are technology based and they don't have access to that, then we miss them out. So that's I think that's where I'm going to leave them. Yes, we build stronger systems for community. Yes, we engage the community. But at the end of the day, communities need to lead this process. And we need to make sure that the tools that we have for them to do that are friendly. Thank you.
Thank you so much, Mara, and thanks for really mentioning that communities, the TB affected communities, have to be in the forefront to the response and supported, provided with technical support and financial support as well, to make community systems strengthening a reality. Thank you so much for that. Let's now move on to practical experiences from the field, and we are going to hear from Eden. Immediately after Eden finishes, I'll request Roderick to quickly just come in. I will not come in between to try to save some time. So each one of us has around 6 minutes to give our examples. There are Q&A session. There's a Q&A box. I will request the panelists to go there and to respond to that. Thank you so much. Eden, come on in, please.
Thank you, Olive. My name is Eden. I am 44 years old and I'm multi-drug resistance TB survivor. I live in Philippines and I was working as a chemist in a paint company when I got sick. I was diagnosed with tuberculosis. Shortly thereafter, I was diagnosed with MDR-TB. After 2 years of TB treatment, including an injectable drug, I was cured. When I completed my TB treatment and was fully recovered, I decided to become a volunteer and went every day to the DOTS Center to help the health workers and the patients. I also educate family members and their communities on TB. I joined an organization whose members are TB survivors and patients who are undergoing treatment. We do activities like educating the communities about TB awareness and prevention care. We also attend some workshops and trainings like leadership training and advocacy training. As the representative of our organization, I also attend meetings in the national and regional level of the National TB Program and other partners for consultations, trainings, seminars, and workshops. We do have a site visits to visit the treatment facilities and speak with the patients. I also give testimonies in some events, telling my stories and experiences about my journey in TB treatment and telling the communities TB is curable and preventable. As a TB survivor and advocate, I also emphasize the importance of supporting people affected by TB. If you are not loved when taking medication, you may give up on it. And I emphasize the lack of meaningful participation of TB survivors in decision-making related to TB. Now, I can really sense the more people are seeing the importance of bringing in the voice of those affected by TB. TB is not just a medical problem, it is also a social problem. No one else can describe and determine how every day feels and what will work, but those of us who experienced the difficulties of having TB. Up until now, the information about the disease and numerous strategies in eradicating these diseases was still unclear to the community. As a TB survivor, our voices are important because we can provide important perspective and can offer powerful tools for advocacy to accelerate the TB response and reach all affected people with prevention and care. The goal of community strengthening system is to improve health outcomes by enhancing the role of key affected population and communities and of community-based organizations in the design, delivery, monitoring, and evaluation of services and activities related to prevention, care, and support for people affected by TB. It is important to ensure that the communities have access to decision-making platforms, that they are able to participate in the implementation of activities and feel that they are able to contribute meaningfully to the TB response. To enhance their participation, capacity building activities must be provided for TB survivors. Funds must be allocated to provide affected communities the opportunity to be able to participate fully in all matters that affected their lives. Thank you so much for this opportunity to share my thoughts.
Thank you very much, Eden. And I think you touched on very key components, especially around capacity development for the TB affected communities, apart from the technical and fund in terms of resources, but also being able to participate in decision-making platforms, which is very critical. I'm now going to move on to Roderick Mugishagwe, who coordinates the Tanzania TB Community Network, and he's going to give examples of how the TB affected communities are engaging in Tanzania. And specifically, Roderick also talk about some of the examples of how what Tanzania, especially civil society and communities, have been able to do. Thank you. Over to you, Roderick.
Thank you, Olive, for this opportunity. My name is Roderick Mugishagwe. Coordinator of Tanzania TB Community Network. It's a coordination platform for civil society and TB affected communities that was established in 2017 as a result of, because at that time there was a rapid scale up of community TB activities, and they were scattered everywhere, and there was no connection of platform that could bring these people together so that we fight we all engaged in the TB response and we fight the disease together. So one of the things that has been happening around, I think, since establishment in 2017, we know that in 2018 there was a UN high-level meeting on TB, and for the first time, and we, as civil society, we are able to come together and come up with the key priorities for the country. Of course, this was through because of the coordination that was around there. That's why we are being able to come together and engage in this discussion around the TB HLM. But also another key achievement has been around the the development of the national strategic plan. Of course, in the past year, I think TB communities were not really engaged. We see the strategic plan has been developed and you don't know how it has been done and our thought have been to that. But because of there's already a platform that coordinates the civil society, so we have been the strategic plan for 2020-2025, which is currently, I think, the process of finalization. So the process started in last year. So we have been able to engage in all the meetings, consultation meetings. We have been part of that, and also we've been able to come up with the position statement of what our priorities into that strategy. So as we look forward, I think the finalization of the strategic plan, we also have a roadmap of which, of course, every time we normally take to see where we are, and also being able to give back feedback to the communities of what has been included, what is missing, and how it looks like. So we normally have that feedback mechanism into that. Another key achievement through the coordination has been to being able to have space in the key decision-making platforms, like we do here at the Ministry of Health as community technical working groups. So through the communities, we are engaged in two of the community technical working groups, one which is around that connect the community TB activities, and there's one because Tanzania is also around the high burden of TB around the mining. So we do have also a technical working group that deals with mining. So we have been given opportunities into those technical working groups also to have where we can take our issues and also get, if we have answers, because it's a multi-stakeholder team. So we are able to also to engage and also give our views and also get response in case there are some issues. Another key achievement has been around the collaboration between the government and the civil society, because through the platform, because now we have, it's a one voice, so we are able to sit on the round table and have dialogue discussions around issues. So normally every year, we normally have 2 dialogues twice a year. So where we come up together with the government and civil society to come and discuss various issues. So this has been from 2017 to now, I think it has been a key achievement for having that big relationship between the government and civil society. But another thing has been, I think was not done in the past, it was around advocacy, especially when it comes to members of parliament, where you find that individual organization used to have to meet with the members of parliament so you find that there was no one voice, not they were speaking on their own, but right now, I think we are able to come together, come up with common advocacy issues, and when we go to meet with the members of parliament, we normally have we are going with as one different organization with just one view, and through the Tanzania TB Community Network. I think another key achievement has been around, we know that community-based monitoring is now currently a way forward for moving into engaging of communities. So through with the ANASO and Stop TB partnership and through the Tanzania TB Community Network, I think the discussion has been around the One Impact, of which was initiated in 2018, and right now there are still discussions with the relevant ministries, because at Tanzania the SC system at community level has been decentralized. So you find that the Ministry of Health is not the only organ that looks at that. So there are so many other authorities that we need to engage. So now we are currently developing a roadmap on how we can engage all parties so that we roll out, we hope by next year, this one will be done. So those are the things around, I think I can mention as achievement. Of course, there are challenges as this is coordinating. We find that most of the donor funding are more service oriented. So advocacy, coordination, and networking activities, they are not really much financed. So we still have a challenge. But also, I think because Tanzania is big, it's a very big country, and the members are scattered across the country. So sometimes coordination, having face-to-face meetings is very challenging. And also given that these are communities who may not, most of them, they don't have this, the technological capacity. So having even these online meetings becomes a challenge. But also, I think there's also have a balance between making TTCN strong, because TTCN has to be, in order to do the work better, it has to be strong, and also make sure that the members are strong. So sometimes the balancing these three things, it's also challenge. But also there's another opportunity that we see through TTCN that we have is it's around because there are not really much organization, civil society that are engaged in TB response. So we are seeing this, the integrated HIV TB integration as key, because through TTCN, we can see we can integrate and bring on board those that are not in the TB response, so that we can have more of a double fight.
Okay. Roderick, if you can just wind up because of time.
Yeah, I'm done.
Oh, you're done.
Yeah.
Thank you very much. We only have 5 minutes, so James, please come on in.
Wonderful. Thanks so much, Olive, and thanks so much to all of the other wonderful speakers. I'm trying to share a screen. Let's go. I've got one slide, and I'll be quite quick because I think what everyone else has said really covers it. But I wanted to talk to a couple of points. And the first is there this idea of communities, and we heard from RD, and then also from Eden, from Mara, and from Roderick, that there are different roles that communities can play. And there are, whether it be around enabling environments, advocacy, network building, service delivery, community monitoring, capacity building, and leadership. But what I think is really key to also consider here is this is very much a journey. It is not so much just something that's sort of a tick box where you can do something and say, yes, we now have strengthened community systems. It is an ongoing journey and an ongoing process. One of the key points, which I think Amara talked very strongly to, though, is also around ownership. And it is very important that communities have a role to play in defining and formalizing what exactly their role and roles are, their needs are, and being given the support that's needed to really carve out that space. I think it's a third point that's there is around integration. And a few people touched on this, and I just wanted to just really emphasize in the context of TB, for community system strengthening, some things that we really need to see is clear principles and interventions around CSFs included in national strategic plans that have budgets attached to them and have clear monitoring and evaluation indicators. Currently, that collection of three things is quite rare, but it is something that I think that we can all work towards and commit towards achieving. The next area I wanted to talk to briefly is looking at this broader context of COVID, because we haven't really gone to much on this yet. And I note, and in my slide, there's a link attached to a recent report which looks at the impact of COVID on the TB response from the position and perspective of communities. And the reason I mention this is because a lot of the immediate responses, a lot of the gaps that were experienced, a lot of the challenges that were incurred, the gaps were filled by community. A lot of the real-time data that was achieved we got it through community-led monitoring. And I know that this was also the case in the Philippines and I think in Tanzania as well. So it's just to note that there is this really important role there, and that role has become even more important in the context of a global pandemic. The third thing is just to note that there are some tools available, and I know that there was a question in the Q&A. These particular tools do not go directly to your question, but there's some tools available which other panelists have talked to, and I think that there's one of the good opportunities to strengthen community systems, and we have seen it in Tanzania, I think in particular, is through the rollout of tools whereby communities are not just information sources, but they own the process and become genuine, meaningful, equal partners with national programs. Hopefully as well, we can look to use existing mechanisms such as Challenge Facility for Civil Society, Global Fund Country, or Strategic Initiative grants, noting the RSSH component of that, which is Resilient and Sustainable Systems for Health, and also local organization networks, which is a funding source from USAID. to really scale up this element. And there's, I guess, a need for TB actors as a whole to prioritize CSS as a broader component of TB efforts. Finally, the UN high-level meeting and the political declaration targets and commitments that resulted. I guess there's a general principle here, and that's that although the word or the phrase isn't used, countries have committed to CSS in TB. They talk about the meaningful engagement of TB survivors and those who are most vulnerable. It lists the TB key and vulnerable populations. It talks about being guided by principles of social inclusion, human rights, and gender equality. There's also particular commitments there about overcoming legal and social barriers and stigma and discrimination, and a multi-sectoral accountability framework whereby you obviously need every stakeholder and community needs to be capacitated and meaningfully engaged and have a seat at the table. So I'll leave it at that. I'll hand back to Olive and say thank you very much to the speakers. And yeah, over to you.
Thank you so much. We only have 1 minute to go. I will not go back to what we have talked about, but just to thank all the panelists, RD, Mara, Eden, Roderick, James, for taking your time to be part of this conversation, and to all the participants for being with us throughout this session. Thanks for all the questions. And I think this is an ongoing conversation. Please get in touch with us, ianaso@ianaso.org, Stop TB Partnership, and APCASO on our websites, and we will be able to give you more information on the tools and guidelines that are there. Thank you very much, everyone. And with this, we have come to the end of our session. Asanteni sana. Thank you, everyone. Bye.